Hi, I'm Jacqueline Cheng. I'm a double board certified facial plastic surgeon practicing at Cheng Plastic Surgery. Today we're going to play green flag, red flag.
Is it a green flag or a red flag when a patient brings in inspiration photos?
Green flag. I always love to see photos of what the patient desires. It allows me to let them know, yes, it's possible, or I can't achieve that.
If a surgeon tells a patient, I don't think you need surgery.
I think that's a green flag. I think it's important to be honest with our patients. If a patient really doesn't need surgery, then I'll tell a patient, you don't need surgery.
Turning down a patient because their expectations aren't realistic.
Green flag for sure. I think it's really important to know whether you can achieve what a patient desires.
A patient asks for the exact same nose as a celebrity.
It depends. So it's kind of a red flag, green flag. It just depends if it's a realistic expectation.
Showing patients before and afters during every consultation.
I think that's a green flag because it's important for them to see my work so that they can decide if I'm the surgeon for them.
A patient has seen multiple surgeons for the same concern.
I think that's a green flag. I think the patient is doing their homework and doing their own research.
Face tuning before and after photos.
Face tuning?
Photoshopping.
What do you mean, after they've had surgery or?
Like if Kate or I decided to Photoshop an after photo to make it look better. Green flag or red flag?
Oh no, that's a definite red flag.
A patient choosing a practice because of TikTok.
I don't think it's a red flag or a green flag. That's how this generation gets information, from TikTok.
A surgeon personally checking in with their patient after surgery.
That is a double green flag. I think you really should check in with your patients to make sure they're doing okay.
Talking about the things that could go wrong before surgery.
I think it's a green flag because I think it's important that patients know the risks of surgery.
A patient asking, can you make me look 30 years younger?
It could be a red flag or it could be a green flag. I mean, what we're trying to achieve is turning back the clock. It's whether I can turn back the clock 30 years.
A surgeon saying that they wouldn't operate on a certain procedure.
That should be a green flag. I mean, I think you have to be comfortable in the surgery you're doing. And if you're not comfortable with that procedure, don't do it.
Patients coming to consultations with a notes app filled with questions.
That's a green flag just because it's important that a patient gets all their questions answered and is comfortable.
A patient saying, I need this done before my wedding next month.
It could be either a red flag or a green flag. It really depends on what they're looking for and if I think they can be recovered for their wedding. I don't want to be the cause of someone not having the wedding that they want because they're still recovering.
A surgeon who has had facial plastic surgery themselves.
Green flag. We should definitely stand by what we do.
What is your personal green flag that you think everybody should look for?
My personal green flag is that if you're thinking about having plastic surgery on your face or your neck, you really should go to a board certified facial plastic surgeon. We have spent our entire career just operating on the face and neck. We did our residency just in head and neck surgery. We didn't touch other parts of the body, so we are the specialists. There are surgeons out there who have gone to weekend courses and they're doing surgery on the face and neck, and they're not as well trained or qualified. If you have any questions, feel free to leave it in the comments. Please subscribe and like. We'll see you next time.